First of all, I'd like to thank BFBA for inviting me. It's always an honour and a pleasure to come and speak at these events. Thanks for giving me the graveyard shift. Everybody's now at the bar, which actually helps me out a little bit. What I wanted to kind of talk about today is a little bit about the hind limb. We're going to look at some anatomy, but not in depth, obviously, because it's a massive subject. But what I tend to find, and was a frustration to me as I was learning, is that not working? Oh, there we go, wrong one. Is that most Farrier texts we get concentrate on the forelimb, because most strain pathologies, concussion pathologies occur in the forelimb, because they are stanchions, they are support pillars for the horse. They keep the horse's nose off the ground, and they basically allow it to turn. There's not much actually written about the hind end. And yet, to me, the hind end is the engine. That's the propulsion mechanism. That's how the horse moves. I don't know if you saw Jürgen Gotthard's lecture this afternoon, his short 10-minute lecture, where he mentioned the hind limb. He kind of brought that point up, that horses, in the natural way of going, are rear-wheel drives. They're not front-wheel drives. And working for 17 years in a veterinary clinic, one thing I kind of picked up on as I was going through working on these lame horses was a lot of the fore-end lameness that we were seeing was actually coming from the hind end. It was a disconnection between the propulsion mechanism and the support mechanism. So we think about the skeleton. We've got two parts to the skeleton. We've got the axial skeleton, including the head, the spine, the ribs. And then we've got the appendicular skeleton. We've got the thoracic limbs and the pelvic limbs. These are support pillars, the stanchions. They are unique because they are not connected to the rest of the skeleton by bone, just soft tissue, muscle, ligament, tendon. But the hind limbs are attached to the axial skeleton through the pelvis. Okay, we've got this hip joint, okay, where the femur slots in to the acetabulum. So when we look at it, we can see that this end of the horse, we look at the bone proportions, they're different. We look, and I teach guys, when I used to teach at the college, we take the difference between the third metacarpal, for instance, and the third metatarsal. They are a totally different structure. The third metacarpal is shorter, broader, and thicker because it has to hold the horse up. It's developed under load. We look at the hind, we look at the metatarsal, it's very longer, it's cylindrical because it's a more efficient lever. Okay? We look at the angulations of the joints. They are different. The knee goes forward, the hock goes forward. Okay? Because it picks its hind foot up, puts it down, and pushes backwards. What also happens is we get the stifle, which is analogous to the human knee, and is a major part of the passive stay apparatus. The difference between the stay apparatus and the forelimb and the hind limb are marked. The horse can actually swap from one hind limb to the next just by flicking the patellar ligament. It can't do that on the front end. It has to hold both feet on the floor to support itself. But it can rest one hind limb at a time. But this joint and the hock joint are joined together. We have this thing called a reciprocal apparatus between the stifle and the hock. So both joints work in unison as almost gear linkages, if you will, to take the energy generated by this large muscle mass down through long tendons, down through each joint to drive the animal forward. We look at the hock. The hock is probably one of the most overworked joints in the equine body. The amount of motion that has to go through and the amount of stress, strain, rotation, shear that goes through that joint is unbelievable. Horses are not natural jumpers. We make them jump. So think about the energy that has to be generated around that joint to actually get that animal over a 3-foot fence, never mind a 5 or 6 foot fence. Okay, it's enormous. So it is prone to pathology. But it does, like I said, work in conjunction with the stifle through that reciprocal apparatus. We get down into the lower limb, and the bones, apart from called metatarsals instead of metacarpals, are basically the same. But they are slightly longer. They are more cylindrical, because that makes a more efficient lever. Okay? The whole point of this hind limb is propulsion, is to drive the animal forward. We look at the muscles in the hind end, and we've got this really large muscle mass. All these muscles then come down through the thigh, and we've got these long tendons that allow the energy that's generated up here to go down here. Okay? Why is the hind foot a different shape to the front foot? Well, the front foot, exactly, perfect. Yeah, because they fulfill a different purpose. The forefeet, as the lady said, share load over a greater surface area through that round shape. The hind foot has actually been designed to dig in to the ground, if it can, and propel the animal forward. So it's more of a spade shape. Okay. So when we think about farriery, we think about toe. We've heard a lot about breakover. Okay. Do horses actually break over behind? That's a big argument. Yes, they pivot over the toe, but they are not pushing the body mass over the spoke of the forelimb. It's already in front of it. It's gone. They're actually pushing the spine forward. And remember, the spine on the horse is quite rigid. And it's fixed together with large muscles, especially the longissimus dorsi. So as that horse propels itself forward, as we can see from the graphic, oops, sorry, wrong button. We can see that it pushes in, it pushes down, comes over, and then lands. So we've got acceleration, deceleration. Okay? So remember again, it's a difference between propulsion and support. How does it move forward? We call that movement protraction. It pushes the limb forward, and it's initiated at the hip. The limb moves forward, the hamstrings relax, at the back, because it's an antagonistic system, and when one muscle tightens, another one has to release or relax. That's how they work. But during this phase, the hip is raised and the sacrum is pushed forward. As that pushes forward, that energy is transmitted through the spine to the front end and actually lifts the front end slightly. That allows the front feet to actually come off the floor. Okay, so as it drives forward from behind, the front end actually lifts up, takes some of the energy or the weight off the front end to allow the horse to get its feet off the floor and to move. Otherwise, it would just stumble over itself. Okay, that can be compromised, though, by rider position, by weight, by shoe, delaying it. Okay, so we need to think about how that moves. The muscles that are usually involved in protraction, and I'm not going to try and pronounce them because I've got a Birmingham accent and I can't even speak English. Okay, but these flex the hip, the lumbosacral joint tilts the pelvis forward, the tensor fasciae lata flexes the hip and extends the stifle. And if you look, we've got extension and flexion happening at the same time. We have a chain of motion. We have muscles that work in a chain, extensors and flexors working together to bring about propulsion. So the quadricep, including the rectus femoris and the vastus lateralis, extend the stifle forward. But then the peroneus tertius flexes the hock, pulls the hocks up. While the stifle is flexed, the long digital extensor and deep digital flexor tendon, the long extensor tendon, pull the limb forward. Okay, so we've got extension and flexion happening at the same time. Then we get retraction as the foot comes off the floor. We have these large muscles called the gluteal muscles that extend the hip and the sacroiliac joints. We have the hamstring group that work down the back. That includes the femoral bicep, semitendinous and semimembranous, and they extend the hip and the hock. Then the gastroc extends the hock, and the superficial digital flexor tendon and the deep digital flexor tendon then pull the foot off the floor. Or do they? Yeah, we've got to remember that energy, kinematic energy is stored, especially within the deep digital flexor tendon, that allows the foot to come off the floor with very little muscle effort. Okay? So just the same as in the front. It's a bit like a pogo stick. Okay? So when we think about Farrier, that thinks about foot placement. For that to work properly, and for the horse to maintain its stride pattern, the foot needs to be in the right position while it's on the floor. Okay, and we know that we work on lots of different surfaces these days. I mentioned the reciprocal apparatus. This system connects the stifle and the hock, so they work together. You can't flex one joint without the other. Okay, so when we look at flexion tests, are we actually flexing the hock, or are we flexing the stifle? We're actually doing both. So a flexion test for a lameness, say for bone spabbing, it's inconclusive. Because you don't know whether the pain's actually in the hock or the stifle. It's one or the other. The anatomy of the reciprocal apparatus is the peroneus tertius, the gastroc, and the superficial flexor musculotendon unit. And when we talk about this unit, we've got to remember that the superficial does not have a check ligament in the hind limb, because it makes its own attachment to the calcaneal tuber. Okay? So it actually locks onto the bone itself before continuing down. So what can affect the hind limb? Obviously conformation. You've heard a lot about conformation if you've been sat in here today. So the position of the hind feet. But when we look at most texts, we see that the feet should be straight forward, just like the front feet. But we know they're not, and they shouldn't be. Because if they were, they would just chop its front tendons off. Okay, so the feet are slightly 5 to 1. They actually should point out slightly. So that's going to affect the way they load and the shape of the hoof capsule. You've heard about loading. I think Dr. Curtis spoke a lot about loading and where loading is. Hind feet don't load the same as front feet. When we look at front feet and deformities of front feet, we see they either deform craniocaudally or mediolaterally. Hind feet seem to deform on a diagonal. For instance, if the lateral heel quarter goes under, we tend to find that the medial toe quarter becomes upright, because of that position and the way the hock is formed, especially the trochlea of the talus. So we look at horses, and we've got to remember that horses work on different surfaces, and they have different surface interactions. Is it working on a deformable surface, on turf, sand school, wax surface, or hacking down a tarmac road? Okay. We talked about propulsion, the way the horse pivots over the toe and pushes down. On a deformable surface, it can actually push into that ground and push backwards. But on a hard surface, it can't penetrate it. So we get an excess of acceleration. When we look at Farrier and we think about the text on Farrier, most Farrier texts I keep mentioning focus on the forelimb and the foot, because assessing hoof balance on a hind foot is a little bit more difficult. We can't assess it with the T-square. I know I'm not a big fan of the T-square. I know other people are. I just find it a bit too simplistic. To me, it's a two-dimensional static view of a three-dimensional dynamic object. It doesn't work. Especially on the hind end. Because of the way the foot is centered and it turns out, because of the trochlea of the hock, we can't use that long axis. We can pick the foot up and highline it in the long axis to see heel height. But I find the best way to assess hind foot balance is to actually look at it while it's loaded on the floor. How is that bone column coming out of the hoof capsule? How is that hoof capsule centered underneath it? Is the toe in the center of the hock? Is it deviating one side or the other? Just by picking it up, as soon as you pick that foot up, it will rotate because of the trochlea of the hock and the acetabellum. So you're not going to get a true picture. It's always kind of going to look inside eye. Or is it inside eye or outside low? So it's a bit more difficult to define, and I think that's why it gets missed a lot. Okay, but we need to take it into account. We need to assess the platform. We need to look at it from all angles. We need to look at the plane of the foot. We need it to be stood on a square surface. When we pick the foot up, and remember it's a quadruped, quite often the lateral side will look wider than the medial. That's normal. But I see a lot of people who are so frightened to actually give a little bit of width on the medial aspect. Maybe that goes back to our old-fashioned undershoeing, where we used to have to shoe them tight on the medial aspect. We're worried about them brushing, about them hitting themselves with the steel on the inside. I find the more I put there, quite often, the better they'll move. Because we're putting the foot where it should be. I find if I need a lateral extension, for instance, I need extra length on the inside to keep that toe in the center of the hock, otherwise it will spin, especially when it comes off the ground. We look at capsular distortions. Quite often these are due to uneven loading. Again, Dr. Curtis talked about loading quite a bit. We can manipulate the load by changing the ground reaction force and moving the center of zero moment while it's on the floor by our shoe. Yeah, wherever we put the shoe, we can extend it one side or the other. We can extend it backwards. We can extend it forwards. But we have to take into account conformation, pathology, if there is any, postural changes. There was a lecture this morning about the difference between a conformation and a postural change. They are different. The horse will adapt to stance to accommodate either a conformation fault or a misguided attempt to correct a conformation fault in the mature animal. So we need to know which is which. We need to think about surface interaction. What's it actually going to be predominantly working on? Is it going to be working just riding up and down a tarmac road 2 or 3 times a week? Or is it going to be worked hard in a sand school? Is it be going cross country, working on turf? Injury. We see this foot here where we've got a false quarter through a wire injury. That's going to change the loading on the hoof capsule that we may have to think about and we may have to accommodate. So why bar shoes? I like bar shoes on hind feet, especially straight bars, especially heart bars. I do not like egg bars. I am not a big fan of the egg bar shoe on front or hind. I think they have more of a role on a hind foot than a front foot, but that's a topic for a different day. But remember what I said about the length on the inside needs to be kind of equal to the outside, otherwise it will spin on the floor. If you put a bar shoe on, you've actually got that, okay, because it's a symmetrical platform. So you can place a symmetrical platform on an asymmetrical foot. We can place the point of force or zero moment more centrally by keeping symmetry around the point of load. And we can maintain equal length of heel. Plus I find on deformable surfaces, they actually keep the foot on the surface rather than penetrating too deeply, especially at the heel. Now this is an horse without pathology. Obviously if you've got suspensory issues on the hind limb, maybe we need to get rid of the bar, put a wider toe on and narrow the heels up to accommodate that. But this is not about pathology. So as I said, I personally prefer straight bars or heart bars over egg bars. One of the main reasons is horses move. They don't stand still unless we make them. The problem I have with excess caudal extension, which that is what an egg bar is, is it looks great when it's on the floor. But as soon as that horse tries to move and he wants to put his foot down, that bar sticking out the back then becomes a lever and will accelerate the toe into the ground. Plus, it's not a straight edge. So instead of just accelerating the toe down, it can twist as well, either way, because it's a point, it's a round end. That can have a dramatic effect on soft tissues. Soft tissues are prone to tension. Okay, so if that horse tries to land, its foot slips, it's going to pull on the ligaments, especially the collateral ligaments. So that's why I prefer a straight bar or a straight bar heart bar. I tend to find as well we get less vertical compression of the heel with the straight bar because we're putting some of the load or sharing some of the load onto the frog. Same with the heart bar. I find with a egg bar, especially when the feet too long, the foot tends to collapse through the middle. Okay, and we get the foot sinking through the shoe. Okay, we've got this rim around the shoe. The horse wants to load centrally and it pushes through. More on forefeet than hind feet. Okay, because the horse can actually take some of the load off the hind feet, but it still happens. We talk about deformable surface interaction. I find bar shoes on sport horses give more flotation on a deformable surface. It helps reduce soft tissue strain, especially horses that have worked hard. And it spreads the load over a greater surface area, again, keeping them on the surface. I find horses that do high-end dressage, high-end show jumping indoors, they actually work really well. You imagine an horse doing a pirouette in dressage. Its heel sinking, it's got to lift them out of the ground to actually move round. That takes a lot of effort. That's going to cause fatigue. If the foot's on the surface, it can actually slide around a little bit more. It's not having to lift itself out of the ground before it can move. If you get an horse that's coming into a jump, again, those hind feet come in, and I tend to find horses that are shod with open heel shoes on especially deep surfaces will come in 1 foot before the other. I find when I put them in bar shoes, they actually bring both feet almost together because they feel more confident. They haven't got to drag themselves out of the ground. They're already there. So that takes a lot of strain off the hock joints and the muscles as it's propelling itself over that jump. We look at the pivot on a deformable surface, and the problem we can get with some deformable surfaces, especially when they're quite deep like this one, is we get rapid displacement of the surface that can lead to slippage. The horse is trying to drive itself forward, all of a sudden it's gone because it's so soft. Okay, it does need a little bit of purchase. So that we can accommodate that with maybe a wider toe, or even I find fitting with a toe clip behind can help with that. Keeping the foot on the surface can help with dorsiflexion of the fetlock joint, and this can help with suspensory issues and SDFT strains before they occur. Once we get them, we have to deal with a lesion, and we may have to think of a different mechanics. But we want prevention is better than cure. I tend to find I have less injuries to soft tissues on sport horses by keeping them on the surface. There's less strain on that soft tissue. There's less chance for it to damage. It can enhance sport. It can make the difference between an horse finishing third, finishing first. Especially when they're doing complicated movements like I've just mentioned, like pirouette. Keeping the feet on the surface can take some of the excess strain off the hock. We can get longer longevity of the working life of the animal. It gives the horse more confidence. And again, that can be a good way of improving performance and preventing injury. Why wait till we've got the damage before we deal with it? Why try and not prevent it? We think about the toe. We've heard a lot about breakover. I'm still yet to find a real good definition of breakover. Okay, it seems to change from month to month, week to week. And then we've got the argument, do hind feet break over? In my opinion, no, they don't. They do pivot over the toe, but is that breakover the same as the forefoot? No. because the body mass of the horse is passing over the vertical spoke of the forelimb. That's breakover. When we get the knees start to break, we get rotation, slight rotation through the coffin joint before it even leaves the floor. And the thing we break over in the forefoot is it occurs in exactly the same place. It doesn't matter what toe you've got on there. All you can change is the amount of energy the horse needs to achieve it. For hind feet, it actually pushes backwards. It lifts the foot up, drives it down, and pushes back, more like a circle. Okay, so can we class those breakover? I don't really think so. I think the mechanics are slightly different. When we look at the firm surface and the same kind of pivot action, this is the same horse you saw on the soft surface. You can see how that toe flicked all that dirt up. On a firm surface, it can't do that. It can't penetrate it. So what we tend to get is more acceleration as the foot comes off the floor, which if we're kind of not careful with, can actually cause soft tissue injury. Okay, so thinking about the toe we put on there will depend on, for me, what surface is predominantly working on, or a combination, because it's got to work on both. So if you look, it can't penetrate. Whoops. What we get is we get external work done, internal work done between the bony segments of the leg, the pelvis, and the trunk, and the muscles. As it breaks, as it comes in, it decelerates. Then we get this stance, this center of mass, and it's a low or high depending on the gait. So whether it's either in walk, trot, canter, gallop, will depend on how high it is or how low it is. Then it drives. We get this propulsion and then recoil. So we've got external work done between the leg and the ground and contact to move the mass of the body and the rider. It pushes forward. Okay? So that creates an acceleration of the foot off the ground, and that can lead to excessive wear. We can add additions to bar shoes. We can put extensions on, whether that's lateral, medial, caudal, caudal. But what we're trying to do is basically put the foot where it should be. If we've got a deviated hoof capsule due to load and a misplacement through conformation defect, we need to basically use the shoe. Once it's attached to the foot, it becomes an integral part of it, to put it back where it needs to be. And that can actually have a direct effect on then the stride. When we think about pathologies like bone spavin, we know that the horse will change its stance. It will compensate for the pain by becoming base narrow, overloading the lateral heel. But that affects the way it moves. Then we get an exaggerated axial swing in the early phases and an exaggerated lateral stabbing motion during impact. By putting the foot where it should be, or the shoe where the foot should be, we can actually negate the damage that causes. It does nothing for the Hock problem itself, but what it does is it stops us having a secondary foot condition. So we're thinking about the hoof capsule. We look at this horse, we've got a capsular distortion, and this is due to pathology. We've got bone spavin, and this is just another type of bar shoe, even though it's not connected. We've got a half heart bar. How much we put there depends. On 4 feet, I like a full frog plate, but a hind foot, I don't really need it. But what I'm doing, I'm actually using this area here as a crutch because the bar is collapsed. That lateral heel is collapsed so much that there is actually no support there. So I'm having to try and fix it externally with the shoe. It's a prosthetic device. We think about negative plantar angles, and these seem to be cropping up more and more, especially horses that are worked on these deformable surfaces. P3 actually tries to drive down through the digital cushion. So we need to think about how can we help these horses. And I find with bar shoes, especially heart bars on these, with a negative or a passive fit works well, or with a pad and impression material. But there's also a relationship to proximal suspensory issues with a negative plantar angle. A lot of vets I've talked to that have been dealing with isospensary desmitis have found when they've actually x-rayed the feet, they've got a negative plantar angle as well. But it's a little bit of a chicken and the egg. Which comes first? We don't really know at this point. But there does seem to be a relationship. So we think about platform. So maybe we can aid that type of foot by giving it something to sit on, by actually bringing the ground up to it, fulfilling that void to stop P3 rotating backwards. And that can be done a number of ways, whether it's with a straight bar, heart bar. If you're going to fit a heart bar, I find with a negative plantar angle, or palmar angle for that instance, I tend to find its best fit in this instance with a negative fit. So you're not locking that digital cushion compressed. You're giving it some room to move. Because we want the digital cushion to compress and release. It's an elastic structure. If we just put a load of pressure on there, we're just fixing it locked. It's never going to work. I tend to find I have better results, actually, with pads and impression material, because it does allow that digital cushion to move up and down. But we can use combinations. We've got spider plates, we've got this plate, that plate, the next plate. Okay, but they're all kind of just variations on a theme. We're trying to give a platform for the digital cushion. I've kept it a bit short because it's the graveyard shift, and I know we're all getting a bit tired, I am. Any questions?
Sorry, I'm just coming over again. Would you mind just saying that into the mic so everyone can hear?
Would you recommend just a bar sheet for all the horses, competition horses that are on wax surfaces?